Greetings. I wish I could be with you in Geneva to participate personally in this very important Global Partners meeting. Our collaborative efforts to reduce the burden of neglected tropical diseases send a message of hope to all people, but most especially to those who are marginalized. Our message is basically, you are important, and your family should have the opportunity to live healthy and productive lives. Congratulations to the governments and ministers of health of the many countries afflicted by NTDs on their efforts and determination to serve the poorest people. I've watched over the decades as national governments and commitments to provide for public health improvements grow stronger. We know that governments must ultimately be responsible for lasting changes in their own nations. The ongoing commitment of the World Health Organization is crucial. I want to express my gratitude especially to Dr. Margaret Chan for her leadership in the fight against NTDs. We know that success is hard-won, and it doesn't happen overnight. I'm confident that the next WHO administration will maintain its focus on NTDs, especially, of course, guinea worm eradication. How many of you have ever had guinea worms? The Carter Center's efforts to help affected countries eradicate guinea worm disease started in 1986, when an estimated 3.5 million cases occurred annually in 21 countries. I must admit there were times after taking on this challenge that I questioned my own judgment, if not my good sense. But because of each country's determination, coupled with your unwavering belief in the eradication goal, steadfast technical support from the CDC, and financial support of the United Kingdom, the Bill and Melinda Gates Foundation, the United Arab Emirates, the Children's Investment Fund Foundation, Hilton, and many other generous partners, we are close to finishing off this debilitating disease. There were only 25 human cases in 3 countries in 2016. This dramatic reduction in cases of guinea worm disease, without the use of medicines or vaccines, would not have been possible without the diligence and heroism of countless village volunteers and the perseverance of the national programs. We cannot be complacent. We must be creative and persistent. The Carter Center will not give up until the last guinea worm is gone. Rosalynn, I, and the Carter Center deeply appreciate the NTD funding commitments from the Gates Foundation to help us meet all our objectives to reduce and even eliminate these diseases. Bill and Melinda Gates are dedicated partners for all of us. The guinea worm program's positive impact on public health and the quality of life inspired the Carter Center to fight some other NTDs, river blindness, trachoma, lymphatic filariasis, and schistosomiasis. With each of these efforts, an equal partnership with the government and the affected communities is essential. Last November, the Carter Center celebrated having assisted in the distribution of 500 million treatments against these diseases. You, our partners, have likewise expanded your commitments to meet these challenges. Rosalynn and I thank all of you for your dedication to fighting these diseases that affect the poorest of the poor. Our world is a better place because you care and because you translate your compassion into action. Thank you very much.